You found us, and we're thrilled that you found us. And we also understand that you've probably been looking for quite some time for someone to help you find an answer to your pain. You've probably been to several doctors, you may have had several surgeries, and no one can seem to figure out what is actually going on. Well, guess what? Dr. Hagan and Dr. Brown can help figure out what's going on. They are some of the foremost leaders in peripheral nerve surgery in the country. People come from all over the country and the world to see these guys. One of the reasons, we will listen to your problem. We will listen to your story. We know you have a pain story. Everyone does. And we want to help you find the answer. These guys understand peripheral nerve more than anyone else in the country. So come visit us. Let's talk about your situation. We want to hear your story, and we want to help you find your answer.
I'm Dr. David Brown, a peripheral nerve pain surgeon in St. Louis, Missouri. When I applied to medical school, they asked us to write an essay about what motivated us to go into medicine. And I wrote about things like I was good at science and I liked working with my hands and wanted to be a surgeon. And when my advisor read that essay, he said, "Where's the part about taking care of people and wanting to help?" And I thought it went without saying. I thought it was a little cliche to come out and talk about, that that's really what I was going into medicine for. And in reality, helping people improve their lives gives me the greatest satisfaction. This week, I saw several patients I'd like to share with you for their 6-week follow-ups. A young woman with post-mastectomy pain syndrome, a coal mine worker who'd had an amputation of his leg below the knee, and an older lady who had chronic severe low back pain after a spinal fusion. All of them were drastically improved. I could see it in their faces. I could see it in the faces of their spouses and their other family members who were there with them. They told me how this pain had been ruining their lives and what improvements they'd had. And that really made my heart fill. This is why we do what we do at Neuropax Clinic. Find us on the web at neuropaxclinic.com or come see me in St. Louis. I can help.
What would you say to someone that said, listen, you know, I've had all these back surgeries, I've been to all these doctors, I don't believe anyone can fix me?
I would say you need to go see Dr. Brown, because I was referred to him by a friend, and it was a chance phone call. And I came in and I had put every egg in this basket because that's how much hope I had. And it superseded anything I could have ever imagined. I never thought I'd have a quality of life again. I never thought I could get up out of bed, not bent over. It's completely changed my life.
So you've had back problems for quite a while, huh?
Probably close to 20 years.
Did you ever have any surgeries or anything?
I had 3 different ablations. I've had numerous injections. Nothing worked, and I'd completely given up hope that I'd have any type of a normal life until I came in to see Dr. Brown, and what he's done, it was a miracle cure for me.
talk about post-mastectomy pain syndrome. I'm Dr. David Brown, a peripheral nerve surgeon in St. Louis, Missouri, and I just operated on a lovely 60-year-old woman who had had a mastectomy and radiation therapy for her breast cancer. She underwent multiple reconstructive operations to rebuild her breast. And after beating the cancer and going through all the health care, she was left with debilitating chest and breast pain for the last 10 years. She's not alone, because 1 in 4 women still have horrible breast pain after 3 years after mastectomy. When the surgeon removes the breast tissue, they cut across all the little nerves that are coming into that tissue. And most of those nerves go on to heal, but some don't and cause chronic pain by firing those electric signals from the ends of the nerves to the brain. Probably 90% of women who have post-mastectomy pain syndrome, it's due to the nerves involved. Unfortunately, this woman had her implants removed several years ago to try to treat the pain, but was still left with the pain because it's almost never the implants causing it. In the office, we can easily identify that the nerves that are coming out from under the ribs, under the arm, and beside the breastbone are the ones responsible, and prove it with small injections of local anesthetics called nerve blocks. Then the operation is pretty straightforward. I removed 5 nerves coming from under her ribs and her side, and 3 nerves from the ribs next to the breastbone. Most patients will be able to tell the very next day that their pain is significantly improved and will tell me, I can feel I had surgery and there's pain from that, but the nerve pain is better. In others, it takes several months, 3 or 4 or 5 months, for those nerves to calm down and improve. It's been one of the greatest things in my career to take care of women with post-mastectomy pain syndrome. If you have this issue or know someone who does, please visit our website at neuropaxclinic.com or come to see us in St. Louis. I can help.
So I came and I did a consult with Dr. Hagan, and he said, hey, I think you have occipital neuralgia. I think you're a good candidate. Let's do a nerve block. And I was like, I've had a nerve block before, but I'll try it, right? He did an ultrasound guided nerve block, and even within like 2 or 3 minutes, I was at a 0. Like for the first time in probably 9 years at that point. Even with like Tylenol and ibuprofen, it's still there. It's just kind of like a ghost, like a 2 or a 3. But that was like a total 0. It like helped so quickly and so much that it actually, I thought I was gonna pass out. I think it must have been from adrenaline, like just from the lack of pain, honestly. So they were like, okay, sit down for a couple minutes. And I was like, this is crazy. So, I was at a 0, I think for almost 24 hours at that point afterwards. So I came in and he was like, hey, let's get you scheduled, right? So I scheduled that. We went in and did my surgery. And I think, if I remember correctly, he had said that, funnily enough, my graders, lessers, and thirds were like all the same size. And normally it's like the graders bigger, the thirds, they're all different sizes. He was like, they're all pretty similar in size. He's like, that's kind of crazy. And my grader on my right side was stretched and twisted in a way that he was like, there's no way anything you could have tried would probably provide you relief, like medication wise, stuff like that. So he removed my graders, lessers, and thirds on this side and my lesser and thirds on this side. And so I have most of my sensation back here. I've got some sensation on this side, but it kind of comes and goes. But healing wise, it was a process. I was, at home not really doing much for probably 6 weeks, 8 weeks. But even then, like afterwards, I was in a ton of pain, but I could tell like, hey, this is sore, it hurts, but it was a different kind of pain. I could tell that whatever was there wasn't there anymore, even though I was very sore. Hey, you had this ordeal done and we're healing, right? Even in those first couple weeks, I was like, I want to go do stuff. I was like, I don't feel like I'm tethered. Like it felt so tight that it was almost like it was tied in a knot and it was tight. And with it being gone and with me being able to even have so much pain relief, even in that pain, I was like, I want to go do stuff. Like I want to hang out with friends. I want to go to concerts and stuff.
Imagine a world where there is no pain, a time to come when patients who have suffered for so long with their chronic pain have found permanent solutions, and they can live unencumbered by the isolation and the anxiety that pain causes. For me, the joy is in continuing to find answers to solve these problems and advance toward that vision. And I've committed my life and my career to doing that. I've written books, given talks at international scientific meetings, and published in the most respected medical journals, trying to reach others who share that vision. Today, there are solutions for chronic pain. I'm Dr. David Brown, a peripheral nerve surgeon, and together with Dr. Robert Hagan and the rest of our team at Neuropax Clinic in St. Louis, our mission is to rid the world of chronic pain one patient at a time. Help us to reach out to people who have chronic pain but don't have solutions. We can help.
So, looking back, what would you tell someone that is hesitant about the surgery or hesitant about going to a headache specialist?
Yeah, I think my biggest thing that I thought about, because I mean, I was nervous being young, it's like when you're used to a certain type of pain, the introduction of new pain or new experiences can be kind of daunting because it's like, hey, I'm used to what I'm feeling now. Like, what if it doesn't work? What if it, makes it worse? And then I really thought about it. It's like, well, the pain that I'm in now, even a 15 to 20% relief would be life-changing. And any form of relief would be life-changing, and the fact that there was even a chance that I'd get like 50% relief was enough for me to be like, it's worth a try. Like, I'm sitting here in pain all the time. We're willing to try so many medications and injections, and it's like, well, why not try something that seems like it would help? And for the fact that I've gotten so much relief, I would say it's worth a try. I mean, I know a lot of people are a little older than I am, so it's really daunting as young as I am for the fear that I would have to live so long with the pain, being worse or being the same. But even a little bit of relief is better than none at all. And so the fact that I've gotten so much is outstanding. It really is, especially thinking that I'd maybe only get like 10%. And now I would say 100%, 98% of the time. I mean, I still have a couple days, every once in a while, but I'm still only, a year out, and other things can contribute, but yeah. you.